Good afternoon, everybody. Hi, everybody. My name is Marcel Baer. I'm the director of MI4. And the best part of these meetings is hearing people talking so much when we start the meetings, because it means that we're all getting together, and hopefully you're bumping into new people you've never met before and finding out about new faculty who are interested in common themes like this. So welcome, everybody. I'm going to start with the land acknowledgement, which should be this slide. And we'll just pause. There's no audio, so just take a moment to think. And I'd just like to add that the land acknowledgement is in the past tense, but the diseases that we study are in the present tense. And the conditions of the past and the conditions of today are very much involved in why we have infectious epidemics across Canada today. This is the list of speakers that we have today. I have the pleasure of making two announcements right now and then introducing my dean to speak. The first announcement is that apparently across Quebec there is a test of the emergency alert system at 1:45 today. So if everybody's phone goes off at the same time, that's just a test. You do not have to run to the doors, you do not have to do anything, and unfortunately our speaker, whoever is speaking at that time, may see that a lot of people are checking their phone at the same time, but that's just a drill. Okay. So speaking of emergencies, our invited speaker, Sir Stuart Cole, contacted me on the weekend that he'd come down with a medical emergency and he was going to try to change his schedule. We tried to work with him, but it just wasn't possible. And he was very disappointed to be not joining us in person. So Stuart will be joining us via Zoom. We have uploaded his slides and we have verified that he is well today and he may be listening in right now. So thank you so much, Stuart, for the effort to try to come here, and thank you for joining us via Zoom, and we look forward to seeing you next time in person. So finally, I'd like to now call up to the stage my dean, Leslie Fellows, who has a couple of titles. She's the Vice Principal of Health Affairs and the Dean of the Faculty of Medicine and Health Sciences, and I'd like to ask her to share a few words. Thank you, Leslie.
Thank you, Marcel, and I am Marcel's dean, but you know the dean probably many people here. So it's not completely one-to-one, but it's a pleasure. Thanks a lot for attending MI4's 7th annual scientific symposium. 7 is that's actually time flies, and I understand the theme today is the importance of antimicrobial resistance and how to address it. My notes say, talk about my own interest in antimicrobial resistance, if appropriate. So I am opposed to antimicrobial resistance. It's obviously a really important, it has been from the beginning, an important focus, I think, for MI4 because it is an important problem in the world and one where research and practice intersect, which is a great place for MI4 to be working, a high impact place. So I hope the afternoon goes well. I was thinking about sort of the 7th symposium and the fact that MI4 has now existed for a number of years, long enough to be sort of an institution of a kind. That's great in the sense that it speaks to the power of the idea, the viability of the notion of bringing together people across not just our Faculty of Medicine and Health Sciences, but across the university and around the world to work together in ways that are interdisciplinary, not bound by the edges of departments and units to tackle important problems. That obviously 7 years of success with clearly a lot of really smart people gathered here today speaks to the it's the proof. The proof of the pudding is in the fact that you're here and that MI4 has done so much good over the last 7 years. So the notion of it, I think, has a proven success. And one of the MI4 is an initiative, because it's therefore not anything else. Right? It's not a center, and it's not all the things that already had rules. which was a good idea to work without worrying too much about structures. But now that you've been running for 7 years, of course, you start to develop potentially some tracks and rules, and some of that is good, that you're finding the places where you can really be impactful, finding the spaces where this kind of initiative can make a difference, and that's to be encouraged. But I had the chance to be briefly at the strategic planning session that the MI4 folks held recently, and I was glad to hear that there's still the important ingredient of innovation in the MI4 thinking, that it's not to find a successful track and just kind of keep chugging down it for 7 years and then 70 years and then 200 years, but to keep the notion of being creative and looking to see where can we do things where the fact that we're kind of free agents to some degree in various systems can continue to be or newly become catalysts for research that really matters. I've totally departed from my notes. MI4 was not my idea, but I've definitely been impressed. It really speaks to things that matter to me as dean, the importance of working together, the importance of really focusing on actually working to better health in all the ways we can, through individual patient care, through better policy. And I think MI4's practical focus on that has been great. So you're well aligned with the faculty's strategic plan. And I think McGill's strategic research plan, which is just now coming through in its latest iteration. MI4 again is I think squarely aligned with what the university sees as important as well. Not by accident. I think partly because of the success that's coming from this initiative and others that try to break down interdisciplinary barriers and really move things forward in a very creative and impactful way. I, of course, only get to be here for my own remarks. I don't know if I started by saying bienvenue à tous et à toutes. Bienvenue à tous et à toutes. I want to get that on a mug or maybe a t-shirt. So I'm sorry to miss the afternoon. I'm really looking forward to hearing the outcome, not only of the events today, but the deliberations that MI4 has been going through about what's coming next. I know the International Advisory Board is just meeting, and so I'm excited to see what's coming from the creative people in the room here and who are involved with MI4 more generally. I wish you an inspiring afternoon. I think the work that you're doing and the thinking that you're doing is important. I'm glad to see so many people here in person from across the university and beyond. And I will now invite Professor Heather Monroe Bloom, MI4 Senior Advisor and Principal Emerita, to say a few words. And while I'm doing that, I'll thank her for the great work she's done in supporting MI4's success. Thank you.
Bonjour, bienvenue à tous et à toutes. Thank you very much, Dean Fellows, for your wonderful comments and for taking the time to be here. And you're reminding me of what the pace of your days and weeks and years are. I'm really delighted to be here, certainly in affiliation with MI4, but as someone who also has a strong personal and professional interest in antimicrobial resistance. Just 2 words maybe on my getting involved with MI4 that link to Dean Fellows' comments, and that is, I didn't want to do it. and Dean Fellows' predecessor said, you can't just say no. I was just moving into having a life post James building, and he said, you have to have lunch with then Don Shepard and Marcel Baer and Tasha Ayanda, who's also been involved from the beginning, and I did, and that was that. I mean, how do you turn back from that? And as someone who was claims to be an epidemiologist, biostatistician with a field of research and teaching and interest, who'd not practiced that for some time, it was also a great opportunity. So I want to just move to today and say how proud I am, just simply by interest and association with MI4, and the audacious vision that came out of Don Shepard's year of sabbatical to actually say, research, is it true that McGill has a unique ecosystem in the microbiology, immunology, infectious disease area, because that was what people were sensing, but there was no concrete evidence of it, and there was certainly an expression of the opportunities to bring people together across fields and disciplines and questions, experiences, to say, what can we do to harness this energy and this talent and the knowledge and expertise here to really do something really different to broaden the impact of all that great activity going on here at McGill, and of course, as Dean Fellows has said, in the partnerships and collaborations and so forth that extend well beyond McGill. And the 7 years has been really incredible. And Marcel, I want to commend you and your leadership over this period. The roles you carry are too many to mention, but you seem to excel at all of them. And somehow you've used all of them to also animate MI4 in ways that maybe weren't imagined. So we're on the heels of two recent and important strategic meetings for McGill, as you've heard mentioned. Strategic retreat in October to think about what now for MI4, and then building on this momentum and the really terrific exchange that happened there. Yesterday, having a meeting with the International Advisory Board, which is really coming to a moment of inflection itself, and thinking about what should that board be for the next iteration, and discussing both findings from the retreat, but very much thinking about how do we say, and I'm sure that Dr. Baer will give a description of the things that have come out of the 7 years, really impressive, and you'll hear from leaders of those initiatives today and related ones, but what should MI4 be doing, in the next iteration, so thinking 5, 7, 10 years going forward. And there's some big things, are there some big questions, what shouldn't MI4 be doing, what should it be doing? And it is really exciting to think about those possibilities. And yesterday was a mighty discussion about that, from taking the provocative question, which I sort of spontaneously put on the table of what if MI4 didn't exist? What would happen? What would we lose? And to a real engagement with that, to thinking about a lot would be lost. There's enormous potential. And then what should continue, and what are some new things that could be done that would go back to that audacious idea and really say, okay, how do we ramp that up even further? So the impact of MI4 is evident, as you'll see today, and from your own work, across the university and beyond. And this is just a great day to allow you to think and reflect further on the whole antimicrobial resistance theme. It's critical importance. Marcel, I loved how you started off with the land acknowledgement, saying, both the good and the not so good, last into the present and will into the future. And certainly this is one of the big issues to be managed. So congratulations on getting to this point, and really looking forward to what happens today. Thank you.
As we do at each year, we try to start with a State of the Union address. So a lot of people come up to us and say, so what is MI4 doing, or what are you doing next, or what have you been doing? And we figure the best thing to do is to just put it out there and say, this is the annual report of what has happened. And it gives sort of a flavor of what's happened over 7 years, and especially what has happened in the last year. And I had a cold last week, so I've got a little lemon drop in my mouth so that I don't cough during this presentation. So over 7 years, we think what we do is we facilitate and foster and coordinate infection immunity research across campuses and affiliated research institutes. We have supported people from McDonald campus to chemistry to engineering. So it's important to realize that MI4 is not a hospital activity, it's a McGill-wide activity, and our goal is to bring in people who we haven't met before from faculties where we normally would not interact, to try to maximize those interactions. What have we done in those 7 years? We recently did an accounting of our spending in terms of what has come out of the MI4 office, and around $20 million was spent on funding grants and teams and research platforms, and also something called co-funding, where you want to apply for a big grant and you need to have a letter from McGill so you're allowed to apply to support, or it's part of the application process, the adjudication process, like a CFI application. So we have funded 48 seed fund grants to people who've never worked together. Some of them are in this room. Sarah Mashid, where are you, Sarah? I think you were one of the first seed fund grant applicants with Momar here, and then you're going to tell us what happened after that. We have funded 7 teams, and some have become McGill centers. We funded platforms like containment level 3 labs and clinical research platforms, so that not everybody has to go through all the same steps. If there's one person in place who's handling one part of the process really well, other people can plug in their research questions and get stuff done faster. And we've co-funded a total of 13 projects. So we ask what came of it, and you can look at it in sort of 2 ways. If you are more from an accounting point of view, and the university wants to know, so you spent $20 million, what did you do? Well, we brought about $60 million to McGill University, and we broke this down between something we call co-funding, where we write a letter that says, while you apply for peer review, if you get that grant through peer review, we will provide you a slice of the funding for that. So this enables people to be competitive in applications where otherwise they would say, oh, well, there's no money for us here. We can't even bother apply. We are not eligible for that. And a different thing is follow-on funding, where we fund a team of people. That team then successfully publishes something, and because they are successful, they go and write a new grant. And in that one, we were able to tabulate, and we think this is an underestimate, of course, because every time we meet people at these meetings, somebody says, oh, yeah, I'm doing this thing that I started with MI4 funding. But so far, we think the $20 million we have spent has brought back about $60 million, or a leveraging of 1 to 3 in total from an accounting point of view. Perhaps more exciting for me is when I just find out that there are new teams and they are thriving. And sometimes we hear because they write the reports and we know what they're doing. And sometimes I'm just going to medical grand rounds and I see Abhinav Sharma is giving medical grand rounds, and he says he's doing a collaboration with Judith Mandel. Here's a cardiologist working with a basic immunologist on campus. And he says, you know, somewhere in his grand rounds, he says, oh, and by the way, with $150,000 of MI4, we got to publish this science immunology paper, and just this year we got $1.2 million of CIHR funding. And I'm like, that's really cool. We helped to make these people, you know, find each other, discover each other, and they are still working together several years later. The Department of Medicine in its planning phase decided to say, who are the really world-class teams we want to get behind and give resources? And one of the emerging teams was this emerging world-class team in pulmonary fibrosis led by Deborah Essiag. And I was asking her, well, where did this exact pulmonary fibrosis focus come from? And this was her funding slide, and says, well, it started with an MI4 fund of $1 million for the team that was looking at interstitial lung diseases, and then we created a biorepository and so on and so on. So here was a team that is now grown, and it has a new focus, and it is now the subject of other funding opportunities and support. So whether we are bringing more funding in or we're bringing more teams together, we see these as both very tangible and concrete successes. What have we done in this past 1 year of funding? We had the MI4 PATHY Seed Fund grant, that these are $75K to each of 2 people to work together. So some of the people are in the room here. Jesse Pappenberg is working with Dan Nicolau, Jeff Gia, with Christian O'Flaherty. I saw Christian earlier. David Juncker is working with Cedric Yansuni, Leo Liu with Brian Ward. We had a MI4 microbiome and rheumatic disease award, and that went to Ira King, and who's there, and Emerson Kroc. We had an MI4 competition co-sponsored with DNA to RNA, the D2R program, and that one went to Erwin Schur. And we were able, with Global Health Fund, to Global Health Programs, to fund 4 seed fund grants to Jonathan Campbell, Ugochi Uka, Joanne Liu, and Prativa Baral. And what else have we done in the last year, aside from funding new projects and teams and saying, okay, go? We've sponsored the McGill Summer Institute in Infectious Diseases, which this year brought in 14 courses offered, brought in just under 1,200 participants from 82 countries, of whom 2/3 are from low and middle income countries. And MI4 contributes to course waivers so that people who could otherwise not afford to take the courses are able to travel to Montreal and participate in the courses. And we've also sponsored, we have meeting support, it's on our website. So this year we sponsored the Canadian Society for Extracellular Vesicles. I think Martin was probably involved in that course. You were not? Okay, sorry. The other extracellular vesicles. There you are, yes, thank you. The American Society of Virology and the Symposium from the Chronic Viral Diseases on Advances in Viral Diseases. And somewhere in the earlier part of this year, we had a Dragon's Den event. One of our dragons, Michael Bescheid, is here. And both Momar and I even dared to present to the dragons and not just simply introduce people to the dragons, but see if our ideas would get skewered or supported so that we would be ready to pitch these ideas and several other people. And we got fantastic feedback from that event as well. In summary, our programs are the same as they have been. We can tweak these, and this is part of our ongoing deliberations and trying to iteratively improve. But we continue to support seed fund grants, and there will be a seed fund grant 7 announced soon, and Momar will be announcing this at the end of the day. We support platforms that are enabling for other scientists to move their science faster. We support new meetings that bring people to McGill to create new initiatives. We get a lot of requests for people to say, I'm having the 27th meeting of the Department of X. It's not really what we're doing, is we're trying to get people who have previously not worked together to say, we want to set up a little meeting to see if we can do some brainstorming and create something new where there previously wasn't anything. We continue to provide seed money for external applications through our co-funding program. And in terms of programs, we're always listening. So if you have a new big idea that can bring several people from this room together, please just reach out and let us know. At this point, we have within the MI4 structure 3 successful themes that are all Senate approved and really just taking off. And they have everything it takes to be successful. The Antimicrobial Resistance Center, who's a co-sponsor of today's event and supported a lot of the organization here, the Viral Diseases Center, and the Microbiome Center. So in fact, one of the big challenges as we look forward is we want to continue to support the successful themes, and we want to look for the next themes for next year's symposium or other potential partnered events with other people on campus. So here's a couple of the emails that you can contact us if you have any ideas. Just reach out and we bring them to our weekly team meetings and we discuss all these ideas and try to make sure that everybody in the MI4 community is part of the decision making. So I'd just like to thank, here's a picture of a 2019 symposium. Susan Avon, were you there? In the old McGill residence basement underneath Park Avenue. There's a picture from last year's symposium. That's Matthew Cheng speaking from Canvas Bioscience, telling us about the company that he's working with. And we've had academic presenters, we've had government presenters, we've had industry presenters, and I think it's important to hear the different perspectives on how the science can move forward. And here's a picture from the Dragon's Den event from earlier this year with Michael and 3 other dragons, including my sister-in-law, and I managed to get through that one unscathed, so I think I'm going to have another event next year if possible. So thank you for your attention, and I think at this point I'm going to be calling Dao Nguyen, where are you? Who's going to be telling us about Antimicrobial Resistance Awareness Week. And then she's also going to be introducing our keynote speaker. Thank you, Dao.
So thank you very much, Marcel and the MI4 team for first making AMR the theme this year. And so my request was, if you're going to make AMR a theme, it must be on the AMR Awareness Week. So here we are. It started yesterday. And Marcel then asked me to take a few minutes to first tell you about why do we have or why do we need such an Awareness Week. And then I'll then just give you a very brief few points about what the McGill AMR Center is doing about it. So, well, AMR, antimicrobial resistance, at least it doesn't confound with any other acronyms, but I would say that I think to the vast general population, people have no idea what AMR is, even though it is one of the greatest public health threats worldwide. And I think that AMR really has a PR problem, because when these are the types of announcements, about AMR, you do wonder, is it about a big meeting? Is it about COVID or global, climate change? So it is really a sort of opaque concept, unfortunately. And AMR doesn't really have an easily recognizable face. It doesn't have an easily recognizable bug. And so I think that the Awareness Week is really that much more critical to spread the word, not only in our scientific community, but in the general public. So some of the taglines that you may see with AMR that perhaps are a little bit more evocative, certainly to the urgency of it, is it's a silent pandemic, the antibiotic crisis, superbugs. I think that this was very popular perhaps 10, 20 years ago. And even though as scientists we don't like it, I think that it really resonates with people, because really the question is, what is AMR? And I would argue that there's a lot of misconceptions out there. If you asked your general public, if I asked my grandmother, they would have no idea. The idea that AMR is something that happens to a person and that the host, the human body, develops it, rather than, it's actually microbes. And the idea that, people have no concept that this can be transmitted outside of the human body, outside of the clinic, that this is in the environment, that it's not just about overprescribing antibiotics, that it's not just about doctors and patients, and that, there are misuses of antibiotic worldwide, but also in so many different settings, in a clinic, in agriculture, in food production, and that really there is no silver bullet. It's not just about the one next antibiotic. It's not just about stop taking the antibiotic. It's so much more complex than that. And to the scientific community, even if you are quite savvy about understanding drug resistance, I would make the argument that antimicrobial drug resistance is not like any other kind of drug resistance if you think about resistance to cancer drugs, or, for example. And there's many, many different scientific reasons for that, starting of which the fact that resistance mechanisms have existed well before antibiotics existed. And so this is not something that we can escape. We can't escape evolution. We can't escape transmission of microbes. We have discovery of drugs that really is not effective, that there's a pipeline that is broken with many reasons for market failure. And so the scientific reasons why AMR is such a complex problem to fix are there. And so here I'm just highlighting for you what are the consequences of rising AMR, why do we need to be aware of this, and to the pressing needs for it. I think that the health consequences are probably known to you, whether if we have infections that are not adequately, quickly treated or cured completely, this could lead to, of course, deaths and morbidity. And I think that those are often the statistics that we see. But there are many other consequences that affect your daily lives and daily lives of people in Canada, across the world, that we may not think about. First of all, many different medical interventions require effective antibiotics, from surgeries to invasive procedures, chemotherapies. Also cost, healthcare cost. The rising of AMR could break our healthcare system, really, by making healthcare much more expensive and increased in hospitalization. And then in terms of our food production, in terms of productivity, these are all enormous consequences, which actually have been put in numbers in recent years. And this is, I think, was really a revelation to a lot of people. About 10 years ago, there was a landmark study by an economist, O'Neill, and at the time, they put numbers and impact on what this rise of AMR would mean. And basically, by 2050, if nothing really changes, we're looking at AMR being the biggest cause of death worldwide, and with an economic cost that I can't even count the numbers anymore, $100 trillion. I mean, it's almost so large it is abstract. And nowadays, now in 2021, we already know that this is attributable to a large number of deaths, more probably than malaria or TB combined, as an example. And so the words that organizations such as the United Nations use is that this is really a global crisis that threatens centuries of progress in health and achievement. In Canada, are we spared from this? Well, of course, you know that we're not spared from this because microbes see no borders. But in fact, the trends are really quite concerning. And you'll hear more about this later on, I think, from our speaker, Yves Lontin. But already, 5 years ago, or actually more, we already knew that about a quarter of infections in Canada were resistant to first-line antibiotics, and that this was already costing well over $1 billion in healthcare cost. And if the trends continue by 2050, if prevalence may raise up to 40% if things don't change, and cost up to 1% of all healthcare cost. And the table here, it's very ugly. All I want you to see is that most of it is in red. Red is increases on all of these bugs over the past 30 years. So overall, the trends are not good. So what do we need? Well, we need actually a lot of things to address the problems of AMR. It goes from surveillance to rapid and actionable diagnostics. We need new therapeutics. We need to know how to better and judiciously use antimicrobials in humans and non-humans. We need to prevent this. And below that, you also need that it's not just a science problem. We need people to be aware that this is actually a worldwide problem that the general public, politicians, decision makers don't really understand what AMR is and why it's important. It's grossly underfunded, particularly in light of the impact that it has in Canada and globally. This is a very complicated field with lots of different sectors and disciplines, and there is a critical need for collaboration, coordination. And then ultimately, there's also a dire need of leadership at multiple levels and political commitment. To give you an idea, yes, Canada has a pan-Canadian action plan that is about a little bit less than 3 years old, which is fantastic. Quebec has not signed on it yet. So there is really a need for advocacy of educating our politicians, our public health deciders, that something needs to be done about it, and now. So the McGill AMR Center, we came out of really the MI4 initiative. And if you read here what our mission is, it falls squarely under what MI4 strives to do in a much broader scope, which is basically connecting people across disciplines, across faculties, to promote the best research, to innovate in education, and do outreach. So what are we? We're really a scientific community that cuts across faculties and disciplines. The membership as it stands is about 60 faculty members and their teams across 6 faculties, 4 campuses, 26 departments. You're as likely to see a microbiologist as a biologist, infectious disease or surgeon, people in environmental science, agriculture, or veterinary medicine. And the center, I'm blessed to work with fantastic colleagues here who help run the center on a daily basis, as well as our program manager, and something that I'm very proud of, our trainee outreach team, which I'll tell you about a little bit. And we exist because, first and foremost, thanks to MI4, this is how the idea came about 5 years ago. And then since then, through the support of the MUHC Foundation, the university, particularly the Faculty of Medicine, and then a number of external partners that have contributed financially to our activities, this is where we are today after about 3 years. And I'm happy to report that we're officially approved as a Senate center a few weeks ago. So I'm just going to take the last couple of slides to kind of highlight, well, what is it that we do? What is it that we do for our community, and what does the community get, and how do they participate in the AMR Center? So we do support research and innovation, particularly by partnering with programs within the university. One that has been very exciting and successful has been the McGill Innovation Fund, for example, for projects that have commercialization potential. We've partnered with other centers, such as the CRBS, on some seed funding, co-funding specifically in the AMR space, and then have created external partnerships that can fund some projects. We're building resources, so a microbial library is a project in development. You should go and talk to Makeda Semret about this project and how we can share and make strains more available for your research, and also a translational research around ICU. Through a variety of other mechanisms, we also promote collaborative research. And then in terms of leadership, and collaboration, this is a very important part of the AMR Center, which is how to articulate it in the context of institutional but also external activities. So through hosting international conferences, leading the creation of a provincial network around AMR, also a pan-Canadian training platform called CanAMRnet. These are all new initiatives, locally and nationally, for AMR. We have partnered across the faculties for every single activity that we have done, whether they be seminars, projects for trainee awards, summer courses through a summer institute. And these are the institutional partners, but also a long list of extramural partners in Canada and in Quebec. Our trainees are very, very important. So we look at complementing what already exists through some training opportunities such as citizen sciences, online mentorship and seminars, and summer courses through the Summer Institute. We do support trainees through scholarships and fellowships. So if you have some that work in the field of AMR, they're welcome to apply. And we have a very active outreach team, which really is about engaging the fantastic energy and creativity of trainees. They organize events, competitions, hackathons, they have career development activities. And then finally, how do we spread the word? And so these are going on through, and if you are getting, you feel like you're getting bombarded by newsletters and AMR announcement this week, I think that we're doing a good job. After that, I promise we'll slow down a little bit, but we have trimestral seminars, an annual symposium. In a couple weeks, we'll have a Meet Your CRBS colleagues to have structural biologists meet with AMR researcher. And we do every year this World AMR Awareness Campaign, which is really driven by our fantastic trainees. So with that, these are just what has happened in the last few days. So go blue. Thank you for all of you who have participated, and some of you are even wearing blue today. There's a packed schedule that they've put together in terms of activities and symposium and campaign booths just to educate people on campus, in the hospital. And so with this, I'm happy that this year we had the chance to do this symposium with MI4 during this week.